vary. Now we move to Deputy Catherine Connolly, sharing with Deputy Carol Nolan, is that correct?
Correct, 5 minutes each.
Yes.
Yes. Minister, I just checked back on speeches and I'm looking at one. I could read it out again to you, my own, in April 2017, over 2.5 years ago. And we don't need to reinvent the wheel, and we don't need to give personal anecdotes of all of our experience with mental illness and the mental health services. And I just want to put in perspective, I come from Galway, where unfortunately we have a group of people who feel they have to do suicide controls and patrol our waterways. And I come from a city where a brand new psychiatric department has at least 4 delayed discharges, patients who are ready to be discharged, but there's no money. And I understand that there's a door broken. I've brought all of these matters to your attention, and I want to move on to general things, but it is a symptom of what's happening in our mental health services, and at the same time we seem to be returning €12 million. So you might tell me I'm totally wrong about that. I've had a background in this area, so forgive me if I'm a little impatient. And back in 1984 we had Planning for the Future, which was a recognition at that point that we needed to do something about our mental health services, and we did. But such was the slow pace of the change that we brought in a vision for change in 2006. Everybody has said, including the Mental Health Commission, a brilliant document, comprehensively set out exactly what was needed, comprehensively set out every area, including the importance of carers and families, including getting rid of the stigma, the high rates of suicide even back in 2006. 10 years. Not alone was the document excellent, but those who were behind the document said, oh, we don't trust this government or any government, so we need an implementation body. And an implementation body was set up, an independent implementation body, and it did its job so well in 2-3 year periods that it was abolished. Now, after it was abolished, we have paid, I don't know what type of linguistic games in relation to a vision for change. And I think it's appalling to use the word a refresh. Really, the review should be about the failure to implement the vision for change, the absolute appalling failure. Yes, some progress was made. The Mental Health Commission acknowledges some progress, but the utter failure to implement it in total. And so what do? We finally, after 2016, when it ran out just in terms of years, we decided to set up an evidence-based review, a desktop review of the literature. And that was done speedily when it did sit, and it reported in July 17. Now remember, the vision for change was January 16, and it took us to July 17 then to get an evidence review that looked at literature. And can you imagine, that literature told us prioritisation of mental health as a major societal issue. Do you think we needed a review to tell us that? Primary prevention and positive mental health, social inclusion and recovery, mental health services, the importance of them, governance and financing. Can you imagine we needed a review to tell us that? And if that wasn't insulting enough, we then need another refresh of the vision for change. When all the time, all we needed was the resetting up of the independent monitoring mechanism to implement the vision for change. At the time that a vision for change talked about money, and there is no parity of esteem, and we can't have health without mental health, and yet we have absolutely no parity of esteem. Now, I know, Minister, on a personal level you agree with this, but you're not here today on a personal level. You're here today as a minister, and you have to tell us why the vision for change wasn't implemented. And you have to tell us today, are you going to put back in the independent monitoring system that was there? It worked very well. I mean, proof of the pudding was that they abolished it because they didn't want to hear the truth. No government, not just your government. And so back in 2006, when a vision for change came in, they talked about a certain percentage of the GDP going to mental health. And they made that comment in the context of the mental health spending that had declined considerably in the 20-year period leading up to the vision for change. So I'm going to finish on time because I want to give it to my colleague, but there is no parity of esteem between mental health and general health, even though both are inextricably linked. There's no independent monitoring, and there's a returning of money when we have delayed discharges, amongst many other things. But most importantly, I want to because this might get through to the government. The economic costs are set out in the review. The economic costs of mental health are enormous, with figures suggesting that it may amount to as much as 4% of the GDP in some countries. In Ireland, it's 2%, at a most modest estimate of the GDP, and this does not include the health costs. I'll stop because it's 5 o'clock. I would appeal to you, Minister, if my 5 minutes are up, just please answer where you're putting back the independent monitoring system. Thank you.